any kind of aggravating factor may be the final straw that sets the condition off. Sometimes if it's a big enough straw, just that one straw will set it off. But other times you may have a big straw that by itself is not enough to set off your condition. You have to have other aggravating factors pile on top of that big straw to be enough to set it off. And that's where people get confused, because it can be different final straws at different times and they don't understand, what's really causing it.
Hey guys, welcome to the Digestive podcast. I'm your host, Bethany Cameron, and today we're talking all about acupuncture and how it can help with so many issues. Matthew Bauer is not only my own personal acupuncturist, but is the author of 2 books, founder of the Acupuncture Now Foundation, and helped to develop the nation's first managed care insurance plan. Dr. Bauer has been practicing since 1986 and went on to study advanced Chinese healing techniques, of which he incorporates into his practice together with Chinese herbal medicine, nutritional, and lifestyle advice. He has dedicated his career to educating people about acupuncture and Chinese medicine and is here today to share that with you. I'm so excited to have you join this episode and know you will benefit knowing the countless benefits acupuncture has to offer. I'm a huge advocate for getting mental and emotional help because our mental state of being is our most important part of our health. Pills may only mask the symptoms of anxiety and depression, but they don't remove the cause and address the root issue. I truly believe therapy can help those suffering with anxiety and depression and believe everyone should have access to it. If you haven't heard about my sponsor, BetterHelp, they offer online therapy with licensed therapists specialized in vast areas to suit your specific needs. They even offer couples therapy as well as teen therapy. And the best part is that you don't have to leave your home, take time off work, or find a babysitter to get help. You can do everything online right in the comfort of your own home. Plus, if for whatever reason you're not jiving with your therapist, you can always switch. So you're not locked in with someone you're not meshing with. You don't even have to have a video call because BetterHelp offers different ways to communicate with your therapist via phone calls only, video chat, and even messages, which you can message them 24/7 without needing to set a schedule. I can't stress enough how much therapy can truly help with your mental health. And mental health is perhaps our most important part of our health journey. So if you want to try BetterHelp, you can get 10% off your first month if you go to betterhelp.com/digest. Again, that's betterhelp.com/digest to get 10% off your first month. Thank you so much, Dr. Bauer, for coming on the show, and it's a pleasure to have you.
And thank you very much for the invitation. It's a pleasure to be here.
Yeah, so for those of you that don't know, that you are actually my acupuncturist, I guess you could say. And so I've just been enjoying it so much. I've seen improvements already just within the short amount of time that I have been getting acupuncture. And so I'm all for it. But I think that a lot of people should know about acupuncture. Now, studies have shown that acupuncture is an effective treatment to help with things like gut issues and digestion, hormonal balance, stress, anxiety and depression, menstrual cramps, addiction, headaches, tennis elbow, fibromyalgia, low back pain, carpal tunnel, and it may also even help with stroke rehabilitation. Now, before we get into each of these topics, I want to have my listeners hear about what happened to your son and what happened when he was born and how he recovered, because I think everyone should know this story.
Oh, well, thank you very much, Bethany. And I look forward to describing about acupuncture. But with my son, and as you and I discussed this subject, because I was letting you know that I have a kind of unique experience with digestive issues, and especially gut health and all, in that my son was born with a congenital condition called Hirschsprung's disease, spelt with an H. And Hirschsprung's is a lack of nerve cells starting in the colon. Now, there's varying degrees of severity of Hirschsprung's. It usually starts at the rectum and then works its way up the length of the colon. And so a lot of Hirschsprung's cases is you have a section of towards the end of the colon that doesn't have these nerve cells. And when it doesn't have the nerve cells, the colon is not able to do the peristalsis. It's not able to dilate. It just stays contracted. And so that causes blockages. In my son's case, he had a really severe case of it where his entire colon had no nerve cells, and even up to about the last third of his ileum. So he had, technically that's called total colonic aganglionic Hirschsprung's, meaning the entirety of his colon had no ganglion nerve cells. And then again, for him, even part of his small intestine. So he was never able to have a bowel movement. He was never able to have any of his digestive essences even reach the colon. So he had his first surgery when he was 9 days old, which in itself was a kind of miracle. The doctors really didn't believe us when he got rushed to the hospital at 9 days old, when we told him that he'd never had a bowel movement. But when they operated on him and opened him up, then they knew, of course, he couldn't have a bowel movement. Now, they didn't actually know that he had Hirschsprung's at first, that he had a section of gangrene intestine inside him, which they removed, but they thought he had what they call a fetal malrotation, meaning that when he was developing as a fetus, his colon did not attach as it should. His ascending to the transverse to descending colon did not attach. It was all kind of, like a bowl of spaghetti or something. And the gangrene part was twisted at both ends. So they thought, well, that was what caused his blockage, was he had this fetal malrotation. They removed the gangrene part of his intestine and then hitched up his colon, but he still didn't have any bowel movement. And they couldn't understand why it wasn't working. They did a second surgery and they saw he had adhesions from the first surgery, and they stripped away the adhesions and it still didn't work. Then he had kind of an emergency surgery where he took a turn for the worse, and this time they inserted a drainage tube up his rectum, but they also tested the intestine that they had removed, the gangrene intestine, and then they did a biopsy, from up his rectum, and that's where they discovered, oh, no nerve cells, he's got Hirschsprung's. So his fourth surgery was they decided to give him an ileostomy, which, kind of like a colostomy is where you remove part of the colon, or you take part of the intestine and put it out your abdomen, and then you wear a bag to take the waste that's moving through there. In his case, because the colon was totally non-functional, they did an ileostomy, meaning that the last part of his small intestine, the ileum, was brought out his abdomen. But there really wasn't any ostomy bags meant for a 6-pound infant.
I want to see, so on the fourth surgery, how old is he still? How many days old?
He was about 5 weeks old, something like that. So they sent him home with us with an ileostomy. They had us talk to an ostomy nurse about how to care for an ostomy, but the ostomy nurse had never had an infant before. Most people are colonoscopies with, older adults. So we ended up having to devise our own way to kind of take care of his ostomy. And the problem is with an ileostomy, you still have digestive enzymes in what's moving through the small intestine, and those digestive enzymes will eat through your skin, your flesh. So, it was really a challenge to find a way to keep those digestive enzymes from getting on the skin of his abdomen without, there would cause an ulcer. And but was also a huge challenge to get him to gain weight. He was born at 6 pounds, and at 6 months he was 7 pounds. So we finally, I started to give him whole milk, and that's something that they had discouraged us doing, but it was actually what pretty much saved his life. And he started to grow after that and started to put on weight. And when he got to be about 20 pounds at around 2 years old, they did the 5th and final surgery with him, which is what they call a pull through, where they connected what was left of his small intestine to his rectum, but his rectum still had no nerve cells. So he basically had a permanent obstruction at his rectum. He couldn't really open his rectum like normally. And so that also meant that he couldn't pass gas. He passed gas during a bowel movement, but he couldn't pass gas, other than having a bowel movement, which his bowel movements are completely loose. So we had to put him on a really low residue, high fat diet. And we were told at that time that he was one of the only 2 children in the world that had survived with that length of bowel. The other was a baby in Russia. I never did hear what happened to that baby, but really there was nobody out there that could advise us on, because it was pretty much uncharted territory. So a lot of it was that, I kind of had to figure out, by trial and error what worked for him. But he ended up with tremendous gas pains. And it was really, was difficult as a parent to watch, because he was a really happy baby, and he could, as a toddler, he could be toddling around laughing, and then he would just let out a scream and drop to the ground and roll on the ground and grab his abdomen, and you could literally see it looked like he had a large snake under his skin. You could see the distension that would happen now this is the small intestine, the degree of distension that can happen with gas that gets trapped. So and also in his case, because he, the colon, of course, reabsorbs the moisture and puts it back into the bloodstream. That's its main job as far as its job in, what it does chemically in the digestive process. With him, if he got any kind of stomach flu or something like that, where he could not be eating and drinking a good amount of food, because the food would come out of him, within, when he was a baby, within, 10 minutes even, anything he swallowed, the way it was when he swallowed it, what would come out of his rectum. So, he had to be on a low residue diet, and especially, vegetable type matter is high residue. So he had to be on very low residue diet. But if he would catch anything like a stomach flu and not be able to push, especially liquids, but to be able to keep filling up, he could get dehydrated extremely quickly. Within 12 hours, he could have severe dehydration and look like a refugee baby or something, to just be very, very dehydrated. So And what would happen is if he would get that way and get severely dehydrated, then, once he got over the flu and could start to take in something, by mouth, then we would see this problem of, it was really difficult. It would cause a lot of gas and a lot of problem because he was so empty that then to try to bring back and start to get his digestive system to be able to tolerate food again was really difficult. So I had to learn how to gradually get his system to be able to be filled up and emptied out again. And this is something that I did with my son. But when I began my medical practice, I actually ended up seeing a lot of elderly patients, a lot of geriatric patients. And I would occasionally see these patients in their late 70s or 80s or even older, people that were like hospitalized and were taken off solids for a while. And then when they were discharged from the hospital and trying to eat, how they had tremendous problems in getting back into a routine of eating a reasonable amount. And, they would be told that they needed to eat, several small meals a day. And I started to recognize that these types of patients, I would see some similarities in what they were going through with trying to get back to a fuller intake of their in their diet was somewhat similar to what would happen with my son if he got dehydrated and then we tried to get him back to eating again. And so I had developed a kind of protocol with my son about how we would gradually work him up from easier to digest foods that would still have somewhat of bulk in the food. The thing I found that for him was pretty much a lifesaver was cream of wheat. And, that would be the first thing other than liquid that we would get him started on. And I would make it kind of watery cream of wheat.
So basically though, what was actually causing in the elderly patients was smaller meals, and you needed to get these patients and your son to have maybe larger meals.
That's right.
Less frequently so that the stomach could fill up that meal and then empty out, as opposed to just always having your stomach working because all these small meals are having to go through.
Well, it's not only that, but I have this philosophy now that the digestive system is really one long tube that starts at the mouth and ends at the rectum. Now that's not my philosophy. That's known to anybody that has any gastroenterologist would agree with that. But that within that tube you have these different chambers: the mouth, the stomach, the small and large intestine. And one of the things they all have in common is on a mechanical level. In order for the digestive system to really be healthy, all of those chambers have to be good at being filled up and emptied out without a real hitch. And so that's what would happen, with my son or people that when they tried to eat larger meals, it would cause so much discomfort in their GI system that's where they got put on small meals. But the thing is, we're all creatures of habit. And if you get into a habit of only filling your stomach up part way, then when you try to fill it up higher to a larger amount, then it's not in shape to do that. It ends up having problems doing that. So
you have to slowly work your way up there, not just...
That's right. So that's the protocol that I developed, especially with my geriatric patients, was how can we get your all the system, but especially with the stomach, how do we get you to be able to reasonably fill it up and not just only a quarter tank?
Right. So you can't just go from 0 to 100. So for those that are struggling, they may have to have smaller meals and gradually increase the volume, as time goes on. Mm-hmm.
And the way we get the volume up is by the type of food, the type of substance that we put in it. So, like I said, cream of wheat, and even how thin or thick is the cream of wheat. That's just one example. But the basic idea of cream of wheat is that, it's in a liquidy base. It's cooked over a prolonged period of time, so it's already partially broken down. And it's something that's easy for your stomach to finish its job of processing and to move on to the next chamber. So, for example, what I have a lot of my patients do at this stage is we're trying to get their stomach and then small intestine stronger at being able to be filled up and emptied out. We work with similar types of foods. So like stews and casseroles, heavy soups, things that have some degree of substance, some degree of heft, because the thing is, if you put really light foods like, clear soups and things like that, it helps the door at the bottom of the stomach to open up if there's some weight behind it. Gravity is an important agent in this whole starting at the mouth and ending at the rectum. Our digestive systems rely on gravity to help open the door at one chamber to pass it to the next one.
Right.
And so finding that combination, you want these foods that are easy to break down because they're already partially broken down, like in a stew.
And that's why I'm such a huge proponent of smoothies. That's what a lot of my listeners know me for, is just making smoothies. And I think that what you had to do for your son was just amazing. You really had to step in and be, his own doctor. And what you're doing now with your practice, I know we kind of went a little bit on a side note here because I know a lot of people are listening about acupuncture, but I just think everyone, needed to know kind of the history and the background and what you had to go through with your son, because it's just an amazing story. But I wanted to kind of shift gears a little bit here now into some acupuncture, and why you do focus a lot on digestion is obviously because you had to with your son's story. One of the things that acupuncture can do with digestion is to kind of help heal it. And how does acupuncture help with digestion, and what is it actually doing to the body in general? Like, what can you say to the listeners? What's happening in the body when you put needles in it?
Right. Well, in a way, it's very easy, a very simple concept, but it's just not the type of idea that people are used to in healthcare. Most of what we do in healthcare is we bring in some sort of man-made outside resources to directly combat a problem or to reduce the symptoms. But acupuncture works by sending information through the body, especially to the brain. I always say a good acupuncture point is one that helps the brain to more clearly see the true nature of a problem going on in the body, so the brain can make better decisions about how to use the body's resources to address that problem. So I'd like to explain to your listeners an incredible body of research that I always say is the most important research ever done on acupuncture. And the reason I say it's the most important research is because it helps us to truly understand how acupuncture works. Now, there's a team of researchers at UC Irvine that for more than 20 years has been studying acupuncture's impact on treating blood pressure. And especially they started with high blood pressure. And what they did was they did a series of over 40 studies over 20 years. Now, most of the studies start with animals and then they carry it over to humans. And they tested a bunch of acupuncture points, and they found these points that reliably lowered high blood pressure in about 70% of test subjects. And they found that was true with both animals and people. But what they did that I so much admire is they tested those same points on those subjects with low blood pressure. And what they found was the same points that were so effective to lower high blood pressure actually brought up low blood pressure. And then when they tested it on subjects with normal blood pressure, it didn't make the blood pressure go up or down. So these were the points that were not making blood pressure go up or down. These were points that were helping the body to figure out what it needed to do to normalize blood pressure, to restore homeostasis. Now, they also did a whole series of very elegant, what we call mechanism studies, trying to figure out how is it that acupuncture can make high blood pressure come down and low blood pressure come up. And they found that stimulating these points, which were basically in the limbs, in the arms and legs, that it sent signals through the peripheral nerves to the spinal cord, from the spinal cord to the brainstem, then from the brainstem to what's known as the limbic system in the brain, which is where the pituitary and the amygdala gland, kind of these master control glands of the brain are. And in the case of high blood pressure, these signals then came back from the brain and to these cells that produce this chemistry that lowered blood pressure. In the case of low blood pressure subjects, the same points sent the same signals along the same pathways up to the brain. But in this case, in low blood pressure, the brain sent back signals that went to completely different cells that produced pretty much polar opposite chemistry that elevated blood pressure. So the same signals from the same points were going to the brain, but based on the information that those signals sent, the brain made two completely opposite decisions about what to do with that information. But both those decisions were about helping to balance out an imbalance and to bring it into line where it's healthiest for the body. And I always tell people that's not just the way acupuncture works for blood pressure, that's the way it works for everything. So it sounds kind of, like you're wanting to have your cake and eat it too or something, but when somebody says, no, well, what can acupuncture do for this or that condition? It's like, well, yes, there's been a lot of studies done that shows that acupuncture can do things like increase peristalsis, or, to increase or decrease gastric acids, or to cause an anti-inflammatory effect when, produce this anti-inflammatory chemistry. But the thing is, it's only going to produce anti-inflammatory chemistry if there's too much inflammation. It's only going to make the gastric acids increase if there's too little gastric acids. It can make the gastric acids decrease if there's too much gastric acid. So, what is acupuncture going to do for XYZ condition? It depends on what the body needs to do in XYZ condition to bring it better into balance, back into homeostasis. So the same acupuncture points can cause the body to do completely opposite different things based on what the exact nature of the imbalance is. So for a lot of cases, we as the practitioners doing acupuncture, it's not like we know, oh, gee, this patient needs a little bit more of this specific anti-inflammatory compound in them, and this is the point that's going to make it do that. We don't, it's actually a good thing that we can't make the body produce this chemistry or that chemistry if we think that's what should happen, because we might get that wrong and make the body produce something that it shouldn't be producing and would be harmful to it. This is why acupuncture is so safe, because unlike bringing a drug into the body that may help one problem that could use that drug but then cause a bunch of other problems, we don't tell the body what chemistry to make. What we tell it to do is good acupuncture points. It's like the squeaky wheel gets the grease. Good acupuncture points kind of force the brain to pay attention to a problem in a certain way that can help it see the problem in a clearer light. So we make a squeak with the acupuncture process, with the needling. we make a squeak. Then it's up to the brain to figure out what kind of body grease it wants to put where.
Research actually shows the average cleaning product contains chemicals that are in fact affecting our lungs. Hazardous chemicals can be found in bleach-based products, disinfectants, degreasers containing several other chemicals commonly referred to as EGBE. It's a common ingredient in liquid soaps and cosmetics even, hairsprays, paint, glue, as well as industrial and household cleaning products. EGBE is listed as possibly toxic to the eyes and skin, central nervous system, respiratory system, kidneys, and liver. The Agency for Toxic Substances and Disease Registry states it also affects development and reproduction. That's just another reason why I use Branch Basics for my cleaning needs. You just mix their non-toxic concentrate with water in a glass spray bottle, and you're good to go and clean your entire home. Everything from your kitchen to your bathroom to your living room and even your kids' toys. Branch Basics is also safe and gentle for your pets, and I've even personally used it to wash my fruits, veggies, and delicate berries. It's 100% biodegradable, fragrance-free, and contains no harmful substances, obviously. Their concentrate is derived from plants and minerals, and the best part is that you only have to buy one product, which is their do-it-all concentrate. And their concentrate literally lasts forever. I probably use it a little bit too much, but it does last a very, very long time. That's all you need. So if you want to clean up your home and your health by using Branch Basics, they're offering my listeners 15% off. Just use code LITTLESIPPER at checkout to receive a discount. I recommend starting with their starter kit, which includes everything you'll need with simple instructions. Again, you can go to branchbasics.com and enter code LITTLESIPPER at checkout. That's LILSIPPER for a discount. A research study from the National Science Foundation found that in all rooms of an average American household, the highest concentration of germs is found in the kitchen. Even more disturbing is the fact that the coffee maker is the 5th dirtiest item in the household, right in between the pet bowl and the bathroom faucet. That same report notes that approximately half of coffee reservoirs have mold and yeast in their reservoir. It goes without saying that coffee makers are the perfect environment for bacterial overgrowth, which is why I threw my coffee maker away back in 2020 and started using instant coffee instead. But we all know how horrible instant coffee tastes and can be for our health. Back in 2020, I found La Repubblica coffee, which makes instant coffee you would never know was instant. In fact, I found their coffee to taste even better than the finest fresh brewed coffee. And I'm not the only one who thinks so. Countless of my Instagram followers have come back to me saying the same thing over and over again. After recommending La Repubblica coffee to them, they're not going back either. Their process is like no other instant coffee out there, with the result of fine powder, no shiny, big granules like the typical instant coffee. It is USDA organic certified, so you can feel confident no pesticides are used. Plus, it's mold-free. It's time to toss out your coffee pot, which takes up space on your counter anyways, and switch to a cleaner coffee you can trust and feel. Once you try it, you won't go back to brewing, washing your pot each night, or buying filters. Go to LaRepubblicaSuperfoods.com. That's LaRepubblicaSuperfoods.com and use the code LITTLESIPPER10. That's LILSIPPER 10 for a discount. So basically, you're sending signals to the brain saying, hey, repair me. And then the body kind of does a scan and goes, okay, where do I need to be repaired or put back in balance?
Yeah,
Is that right?
It basically sends a signal and says, hey, pay more attention to this. Are you really happy with what you're doing with this problem here? With this imbalance? Are you sure you're making the right decisions about how? Because see, what happens, Bethany, is that our bodies, of course, living organisms with trillions of cells. I mean, there's literally more cells in the body than there are stars in the universe. I mean, it's mind-blowing to think about this. But all of those cells are living little entities on their own, but of course they gather together to make bigger entities and bigger entities, to make cells, then cells that form different tissues and all these different things. But all of those cells are constantly struggling to stay in the sweet spot of what it is they do, and what body chemistry and body resources help them to do their job in the right way. So our cells are constantly sending status reports through the body's information gathering systems, which the nervous system, of course, is a huge part of it. But there's many other ways the body communicates how the cells, these different status reports. And then especially if something happens that's a threat to the body, like if you get a tiny paper cut, in a split second, all sorts of alarms go off and a whole series of measures is put into place to address this threat to the body's well-being. A tiniest paper cut, within a split second, first responders are sent over to that breach in the exterior walls. The platelets are produced to coagulate the blood and to stop bleeding, and the immune system has to kick into gear to start to fight anything that might have got in through the breach. So this is what could be referred to as a signal and response system. Our cells are constantly sending signals, especially our five senses, but are constantly sending signals to the brain, and who knows who all else is involved in this regulatory system. So signals are sent, and then those signals are a decision is made about how to respond to those signals. And so basically with acupuncture, we break into the signal and response system. We're hacking the signal and response system, and we're trying to force the body to take another look at an existing problem to figure out whether it's really doing all that it could for it. So that's the way it works.
So to put it almost in simpler terms here, if the body is not really working to its ability, you're basically hacking it. Let's just say, for example, someone with digestive issues, right? The body may be at a quote homeostasis, being like, oh, I'm good. I don't really need to repair myself anymore. But then with acupuncture, you're kind of hacking that and being like, no, hey, look at me again, rescan my body,
right,
and then go and repair me.
Right. Well, just like I said with the blood pressure, when they did those points on subjects with normal blood pressure, it didn't make the blood pressure go up or down, because it didn't need to change that kind of chemical balance in the body. But when there's a problem, good acupuncture points are ones that help. I always use this to make it simple. Good acupuncture points are ones that help the brain to more clearly see the true nature of the problem, so it can make better decisions about how to use the body's resources to address the problem. So, the body is putting out, probably more than 1 million fires a day. And even though it is amazing, it's nature's incredible intelligence about how it keeps us all together, these trillions of cells, to keep them functioning. That doesn't mean that it's always doing the very best it could for each and every fire that it's dealing with. Anytime you have a pain, anytime you have any kind of discomfort, the body is getting a signal that there's something wrong, but that doesn't mean that it's seeing the problem in the clearest light it possibly could, because it's got a bunch of other problems to work on. So in Chinese medicine, for example, this is going back 2,000 plus years, the Chinese talked about this signal and response system, the way the body is keeping itself, maintaining homeostasis. They referred to it, now this is when China was for a long time, it was really the most complex administrative governmental system on earth. It was a huge country with a large population, and they had very sophisticated levels of administration, with the emperor being the top, at the top of the pyramid, right? But you have all sorts of different layers of administration, and that's the way they talked about the human body, was saying that the human body was as complex as the Chinese Empire. There's a lot of people, like a lot of parts that make up the body, and there's all these ways of communicating what's going right, what's going wrong in the empire. And eventually, it gets filtered through these different layers of advisors and administrators, but eventually can reach the emperor. And then the emperor makes a decision about how to use the empire's resources to address whatever problem there is. So I always say that good acupuncture is like, when you have problems in the body, it's like you've got thousands of village spokespeople outside the palace walls shouting to the emperor, we've got this problem, we've got that problem. But what you need is a good articulate spokesperson to have a private audience with the emperor, to tell him what's really going on, so that the emperor can make better decisions about how to address that problem. That to me is like what good acupuncture points are. Good acupuncture points force the emperor to really pay attention, to then decide how to make the best response to those problems.
Now, are there certain acupuncture points for different situations and different problems going on in the body?
Yes, all different aspects of the body, including the digestive system. This is something that there's really two things here. One is incredibly long trial and error, that practitioners learned over time, these points seem to be really good for this problem. But now that's something that I believe happened over thousands of years. Just trial and error about different spots in the body and how it seemed to help these problems or those problems better than other spots did. But what happened with Chinese medicine, which is so amazing, was that they developed a theoretical model based on yin and yang dynamics, which is really polar opposites trying to keep each other in balance, based on this theory of yin and yang dynamics, and about this subtle force of nature that they call qi or qi. It's called different, slightly different pronunciation. But the whole idea is that this qi, this subtle force of nature, is flowing constantly. It's the force that is feeding all of the evolution and change that happens in nature. And it's kind of like an irrigation system bringing water to all these different plants in a vast farming complex. It gets carried through these channels like irrigation canals, and then that goes down to smaller irrigation canals and the smaller irrigation canals to water the individual plants. But if there's a blockage somewhere in the irrigation system, it causes the water to back up and to overwater upstream from the blockage, and then to dry out and underwater downstream from the blockage. So the whole theory of acupuncture is, when I say good points, the good points are the ones that help to break up blockages. And when you break up the blockage, then the water starts to go back to its normal level. And when the water goes back to its normal level, then as long as the damage done to whatever plants got overwatered or underwatered, as long as that damage done to them did not go past the point of no return, then if you bring the water level back to the normal level, the plants will heal themselves. And that is exactly what we're doing. Yeah.
So we're allowing our own body to heal itself. And I think a lot of people think that acupuncture, you have all these needles like all throughout your body and you're just covered with these needles. And I feel like that's obviously just not the case. And so you may have maybe just 5 needles, on your body. And so just want to make that clear for everyone thinking that you're just covered with needles here. And pressure points too, they may not be what a lot of people think. For example, digestion pressure points, correct me if I'm wrong, but that's more than just on the stomach. There's pressure points on the ears that affect the digestion, or on the legs that affect the digestion. Right. Now, what about pressure points for migraines?
Well, migraines, like so many problems, there can actually be multiple variations of those that give very similar symptoms. So, with headaches, and even including migraine headaches, in Chinese medicine terminology, there can be many different types of imbalances that lead to those symptoms. So we do try to break it down to be more specific about that individual. So a lot of people in Chinese medicine will say, we don't treat conditions, we treat individuals and their imbalances. But on a practical level, there are certainly similarities between, most all of these cases. So like, for example, for most headaches, including migraines, the basic imbalance is going to be that you have too much energy in the head area. And so to counterbalance that, we want to draw energy down to the lower part of the body to drain it down from the head. So a lot of the points that are used for headache, for example, are going to be on the lower extremities, like the lower legs, the feet, maybe the lower, arms. But the whole idea is that if we stimulate the attention on the lower part, it kind of helps to drain the excess from the upper part. And this is what, I mentioned about the irrigation system, using that analogy about the channels or the meridians of acupuncture and the points that are on those channels. And so the whole idea, though, is to take from where there's too much, and especially if you can give it to where there's too little. And so most headaches are a condition of an excess in the upper area, the head area. So we try to balance that by drawing down and stimulating lower points.
Yeah. Well, and I feel like headaches and migraines are actually the result, or a quote side effect of something else happening in the body, like stress. That brings on headaches. If your body is having a lot of pain in another area, then that could bring on headaches too. So maybe you don't need to address, this is just my, thought process, is maybe not addressing the headache, but addressing what's causing the headache, like the stress. I know that acupuncture can really help with stress and anxiety, and even depression, it's been shown. So how does acupuncture help with those issues?
Well, again, the acupuncture is going to kind of send this information highlighting where there's imbalances in the body, and with the hope that the body will respond, making a better response to that imbalance. So, but many conditions, Bethany, and this is something that I wrote a book many years ago, and I talk about this in some detail, is one of the things that modern medicine is so fantastic at, and it was such a revelation back in the early 1900s when they got on this bandwagon. But when they, especially when the microscope was developed and everything, and they discovered, little things down to, bacteria, and even smaller, tiny things like viruses. And in other words, much of what we think of in healthcare is we think of a condition being caused by one, pathogenic factor. a singular cause for the problem. Oh, this virus is what the problem is, or this bacteria, or this kind of, specific chemical imbalance. And it's absolutely true. There definitely are conditions that are caused by one big factor. But if a condition can be caused by one big factor, it also has to be possible that other conditions can be caused by a piling on of smaller factors, multiple factors. And I always use this analogy, like most people have heard that expression, the straw that breaks the camel's back. That analogy comes from this idea that you're piling straws on the camel's back and it's holding up. But you get to a certain break point where just one more straw causes the camel's back to break. And what I like to point out is the same thing happens in reverse, though. We can lift a straw and another straw and another straw to help heal the camel's back. So many conditions, like headaches, are actually not caused by one big thing. They're caused by a piling up of multiple factors. And for any person, even for any one person at any two different points of time, any straw, any kind of aggravating factor may be the final straw that sets the condition off. And that's where people get confused. And this happens with digestive issues too. People say, gee, I thought this food was a factor, was what was causing my problem because I ate that food and bam, I got these symptoms, whether it's digestive system symptom or headache. But other time I ate that same food and it didn't bother me. It didn't set it off. So it's like, well, wait a second. When I talk about a straw that breaks the camel's back, there are actually big straws, medium straws, and small straws. And of course, the bigger straws, sometimes if it's a big enough straw, just that one straw will set it off. And that's what I mean by single cause conditions. But other times you may have a big straw that by itself is not enough to set off your condition. You have to have other aggravating factors pile on top of that big straw to be enough to set it off. And that's where people get confused because it can be different final straws at different times and they don't understand, what's really causing it. So of course, anytime we can help address if there's a big straw or two and we can do something to really lift that straw or deal with that straw, well, just helping that one factor is equal to helping a dozen other factors. You see what I mean?
No,
but
totally.
For many conditions, it's like, hey, let's leave no straw unturned. If we can identify and go after and really reduce a big straw, by all means, that should be the priority. But let's work on as many straws as we can, because sometimes you can't change the big straw very much, but you can do something about these smaller straws. Now, whether that, like with acupuncture doesn't take a straw away necessarily, but it helps your body, it helps your camel's back to be stronger to withstand that straw. But if we can identify things like in diet, like in lifestyle stresses, like in many different factors, if we can identify what is a negative factor, what's a straw on the camel's back, and you can avoid it, by all means, avoid that straw. Especially in the beginning of a treatment process where we're dealing with multiple factors, we don't want to, ignore any factor. Let's work on as many as we can. And once we help reduce those negative factors, and especially with acupuncture, strengthen the body's ability to withstand those negative stresses, then maybe you can start to add back, one at a time, some of those things in your diet, some of those activities that were negative factors. Now maybe your system is strong enough that it can withstand it. So it's not like, okay, you go off of these things in your diet or you change these lifestyle habits. It's not like you have to do that necessarily the rest of your life, Now, maybe if there's a very big straw, like something in your diet that is the big straw, well, maybe that is something you should avoid for the rest of your life.
Sure.
But those are all things that we try to figure out as we do. In Chinese medicine, acupuncture is unique, I believe, almost, in medicine, in that it is this system that helps your body to better see where the problems are. So it'll use the body's resources more effectively to help it to better achieve homeostasis. That is an amazing thing to think about. I mean, it's like, wow, if we could help fine-tune your body's effort to maintain homeostasis with a safe therapy like acupuncture, who wouldn't want to take advantage of that?
You guys know how picky I am about every ingredient and product I recommend. So, anything I personally create won't be any different. So, in case you haven't heard, I created my own supplement line called Bethany's Pantry. Newzest has allowed me to formulate my own products under their company as a sister brand. Any and all of Bethany's Pantry products are created by yours truly, me. Every ingredient and sub-ingredient has been approved, again, by me, along with the origin of the ingredient. The taste, texture, and overall combination of ingredients in my products are created specifically for those with sensitive tummies, designed to help improve digestion, nutrient absorption, and ultimately your health, all while making it enjoyable and easy to consume and incorporate into your daily lives. Now you can be 100% sure you are getting a little sipper item if it's under the Bethany's Pantry label. I'll be rolling out with new items gradually as time goes on, but for now, I currently have these 5 items available, which are my Digestive Support Protein Powder in vanilla, cacao, and strawberry, my Plant Protein Bake Mix, and Digestive Support L-Glutamine. These are just a few of the many items in Bethany's Pantry to come, and I can't wait to share what's next. So head on over to newzest-usa.com/Bethany's Pantry to check out everything I created. Again, that's newzest-usa.com/Bethany's Pantry. newzest-usa.com/Bethany's Pantry. It sounds like that basically you're helping the body to adapt. And whether that, because the body is so connected. So if you're thinking about digestion, well, maybe you're really having bad digestion because you're super stressed, or you're having bad headaches because you're stressed, or your hormones. I want to talk about hormones for a second, because maybe your hormones are out of balance, but your hormones are out of balance only because maybe you can't digest the right foods, but you can't digest the right foods because you're really stressed, or your hormones are out of balance because you're stressed and you have higher cortisol levels, and that's sending signals. So again, the body is so connected where you may just think you have hormonal issues, but you really have a stress issue, or you really think you have digestion issues, but you really have the stress, or you really have headaches, or this pain, this, here, that, and this and the other. And it's truly just super connected. And for those that are looking for a hormonal balance, can you just elaborate on that and how acupuncture can help with hormones?
Yeah, I'd love to. And hormones are really probably the best example we have about how nature works and how acupuncture works with nature. Because now when I began my acupuncture training, in acupuncture school, we had to take Western classes and learn about physiology and anatomy and all of these things. Not at the level medical doctors do, but we still had to learn a pretty good amount of that. And I had studied Chinese Taoist philosophy with a Taoist master for several years by that point. And I learned about this whole yin-yang dynamic concept, about things we call the 5 elements or the 5 phases and all of this thing. I had not had much Western science training at that point in my life, but when I went to acupuncture school, I was learning that. And when we were learning physiology and we were learning about the hormones, it's like I was learning, the hormones work by what they call a negative feedback loop, where everything is holistically interconnected. And I'm like, oh my gosh, that's yin and yang. I was completely familiar with the concept, but I had learned it from ancient Taoist science. Now I'm learning modern science about how hormones, how the thing is with hormones, this negative feedback loop means you don't have black and white cause and effect. Everything affects and is affected by everything else. And that's what makes it so difficult for even today in modern medicine to really say what is a hormone imbalance, because it's constantly shifting and everything, it's how everything adds up together. So this is the exact model that Chinese medicine has been based on for more than 2,000 years. So we help the body to figure out how to better balance, to keep all of these balls in the air, juggling these balls all at the same time. Again, we help that by highlighting where there's imbalances, so the body realizes, oh, I need to do a little more, up this a little bit and reduce this a little bit. And that especially applies with hormone issues. And, we can, of course, see that, especially like in female reproductive hormones, and women's have these cycles, and boy, the cycles get thrown off. And, it's so easy to see how this negative feedback loop works in nature. And that is what Chinese medicine has been based on for more than 2,000 years. So in modern medicine, they really struggle with negative feedback loops. The best you can do is kind of approximate things and hope if you add more of this hormone or block that hormone, that it won't too much disrupt this delicate balancing act. But I also wanted to say, Bethany, you mentioned about stress. This is something that most every acupuncture patient will attest to. But one of the things that would really surprise people that have never had acupuncture before is that acupuncture tends to be extremely relaxing to people. When people have the needles in place, and usually, we put these in and they're left in place for 20 to 25 minutes, somewhere in that time frame. And most people go into a deep state of relaxation, even fall asleep with the needles in them. And it also happens in veterinary acupuncture, treating animals. The little dogs or cats or horses or turtles or whatever, they actually start to nod off and fall asleep and just go into this deep state of relaxation. And I'm convinced that this happens because, again, acupuncture is breaking into the signal and response system. Now, normally, like I mentioned about a paper cut, about how that sets off all sorts of alarms in the body. Well, just imagine if you are punctured 5, 10, or 15 times with acupuncture needles. Even though the needles we use nowadays, most of us use, are literally hair-fine little wires. That's why there's, I always say the average sensation of these super thin needles being inserted is less than a hair being plucked from your head, and about as bad as it gets is like an eyebrow being plucked. But still, your body senses that it has just been punctured with multiple projectiles, right? Now, normally, over millions of years of evolution, if your flesh gets punctured with multiple projectiles, you got a real problem going on there. So it's almost like emergency mode. So acupuncture forces the body to go into a kind of almost emergency state of saying, what's happening in here? How did we get, what we got penetrated? What is happening, and what do we need to do about it? And for your body to do its best job to respond to a potential threat like that, it is going to shut down some of the outside activities so it can really go inside to see what is happening inside.
Yeah, well, you mentioned that it relaxes the body. The very first week that I got acupuncture, I was so tired, and I had asked you even, I was like, man, I am completely tired. Like, I just want to take a nap. Right. And that was a clear signal that my body was completely relaxed and truly going through some repair process.
That's right, because it's like a seesaw, like yin and yang. When your body is really active, then it can't be doing repair at its highest level. When it's doing repair at its highest level, then it can't be doing activity at its highest level. And this is also true with the mind that is engaged and busy with the outside world and how we're, acting and reacting to the outside world, and the mind that goes inside our body to, kind of the subconscious mind that is involved with doing the maintenance and repair inside us. So with acupuncture, the reason people, their minds slow down and they go into this deep state of relaxation, so typically with acupuncture, is because it's saying, hey, we've got to look inside right now. You can't be too busy thinking about the outside world. We got to worry about the inside world. Acupuncture is almost like a side effect of acupuncture, that it is calming, relaxing, and de-stresses the mind. So that happens no matter what kind of problem we're treating. People end up getting stress reduction almost as a side effect of the treatment.
Well, that's the great kind of side effect we want, right? I mean, and then so basically there's so many things and topics that we could cover. I mean, like I had mentioned, like it could help with stroke rehabilitation and pain in the body and joint pain and so many different things that we haven't even gotten to. But basically anything, it's putting the body back into homeostasis, back into balance, and for whatever maybe issue that you may be experiencing. Now, for time's sake, I did want to ask you just a few questions. How often should one get acupuncture, like per week? Would it be once a week, twice a week? And then when should someone really start seeing results? I mean, I don't want people to think, man, do I go once and I start feeling results, or do I have to do this for a year? Like what's the typical time frame?
Well, there's a difference between really acute problems and chronic problems. Now, with so many acupuncturists end up dealing with chronic problems because they're people that have been going to different doctors and they've got an ongoing issue that's not resolving, and they end up coming to somebody like us. So we deal a lot with chronic problems. But sometimes we see these acute problems. And the difference is, with acute problems, you treat them more frequently, even daily. Like, somebody maybe sprains an ankle, and you could do a treatment, every day for 4 or 5 days, or every other day to do, 3, 4, 5 treatments or something to really help speed the repair of that kind of acute injury, right? That's something that people are going to recover from. We can speed it up. But for most chronic problems, it takes a series of treatments over a period of time. And it should be really 3 stages to treating chronic problems. The first stage is to make anything noticeably positive happen where the acupuncture is doing some good. And I always consider that first hurdle to get over is actually the most important hurdle. The second hurdle in the second phase is once you're doing some good with the treatment, then you try to build on that and take it as far as possible to reach what is really the maximum benefit you could get out of the treatment. And then the third stage is to try to make sure whatever benefit you've got is going to be as stable as possible. So each of those 3 stages has their own kind of qualities and characteristics to it. But, as a ballpark sort of thing, Bethany, often the first stage to make anything positive start to happen, well, if it's a condition that a patient has that is very consistent, if it's something like it's pretty much, it stays very regular, like say somebody with headaches that says, oh, some days I get, headaches every day for a week, then I might go 6 months without any headache. Well, that's kind of difficult to say, well, gee, how many treatments to get that first response of improvement? But for somebody like, say, somebody with a frozen shoulder that can only lift their arm to 90 degrees, we might do 1, 2, 3 treatments, and now we can see they can lift it to 110 degrees. So we can see we've already, improved that by 20 degrees. But in general, I always say that you've got to give a good 5 or 6 treatments for most conditions to give it enough chance to see that it responded. And that's doing at least once in better, it's far better if you can do 2 treatments a week. It's a way better way to get started with acupuncture. In China, even with chronic conditions, they like to start every day or every other day, but usually every 3 to 4 days, a couple treatments a week is usually a good compromise to give the treatment a chance to work and to start to build some momentum. So a typical kind of treatment, maybe somebody's had a problem for even 5 or 10 years. We might do 2 treatments a week for the first, 2 to 3 weeks. And we see we're making progress. Then we might go down to 1 treatment a week for about double that time. So if it takes 2 treatments a week for 3 weeks to see progress, we might then do 1 treatment a week for 6 weeks to try to take it to its maximum. And then to make sure it's stable, then we stretch it out to a longer period of time, like 2 to 3 weeks, to see that you're not backsliding now that we're not doing regular treatments. And if there is no backsliding, then that problem, that improvement should stay stable for long periods of time, if not for forever. So that's a kind of typical scenario. And now, of course, a lot of times there's setbacks that happen. Something happens to the patient that adds to their problem or re-injures them or aggravates the problem. Well, then we have to kind of reset those numbers. But that's a basic kind of scenario that would, be a reasonable ballpark for quite a few problems.
Okay, great. And now where can one find a good acupuncturist? Is there a good resource you can let people know?
Well, and really, it's like saying, where do you find a good medical doctor or something? Nobody puts themselves out there and say, don't go to these people, only go to those people, right?
Is there maybe a website with just
right.
acupuncturists listed?
That's right. So, I started a nonprofit foundation called the Acupuncture Now Foundation. And we have a website, which is ACUNOW, so acunow.org. And we have listings on there for how to find acupuncturists. But I would say, there are acupuncture specialists like me, people that are licensed acupuncturists, that acupuncture is our primary thing or our only thing. But there are other types of healthcare providers. Most medical doctors, in most states, medical doctors can do acupuncture without any training. In quite a few states, chiropractors can do acupuncture with as little as 30 hours to maybe 200 hours of training. So there are, and on the acunow.org website, we do have listings for all of these types of acupuncturists. But if somebody has the option to go to somebody that is a specialist in it, and it is their main thing, they will usually be, the more experienced practitioner that has more extensive training. So those are licensed acupuncturists or certified acupuncturists. They're called somewhat different in different states, in the US anyway. But even in other countries, there are going to be similar things where you have these acupuncture specialists that are the people that really have this as their main discipline and their main training. And if those are available to you, that would be my first choice, is to go to the people that have the most experience.
Okay. Yeah, that's great. And then I know that for each acupuncturist, I'm sure people are going to ask if it's covered by medical insurance or not. And there are some that are and some that aren't. Is that correct? It just depends on the practitioner?
Yeah, the insurance coverage with acupuncture is all over the map because, different insurance companies set their own policies. So it's not like, it's really, sad to me is that, sometimes, like when our office is verifying insurance, which is something that my wife has had to shoulder for many years, but you may call one insurance company and they say, "Oh, we do not cover for this condition," and then you call another insurance company and it's like, "We only cover for this condition." You see what I mean? So they may have completely different ideas about what the evidence is for acupuncture and what acupuncture can treat. So with insurance, it's unfortunate, but we just, like any acupuncture office that accepts insurance, has to literally call the insurance company and ask them specifically whether this plan for this person covers acupuncture for this condition. And even then, they may give unreliable information. The person may say, yes, it does, or no, it doesn't. And then you call the same company and talk to a different person later, and they tell you something different. So it's a little bit tricky because this is such a outside the box thing for them. Most insurance companies don't really have, reliable policies about how they cover that. But there are a lot of insurances that most of them will cover for common pain conditions like headaches or back pain or knee pain or neck pain or things like that. But when you get into the long list of other things that acupuncture really can effectively treat, then it's very hit and miss about what insurance policy is going to cover any of those things.
Yeah, well, it sounds like it's all individualized, but the good news is it is possible to get it covered by your insurance. So I guess you would just have to check with your insurance, see if it's covered, and then just go from there. But if it's not, obviously you can pay out of pocket, and it's pretty reasonable, I would say. And I'll be sure to put your website in today's show notes so people can access it easily and hopefully find a good acupuncturist there. Thank you so much, Dr. Bauer, for joining me today. And I cannot wait for everyone to listen.
Great. Thank you very much, Bethany. It was wonderful being with you. I really appreciate it.
Thanks for listening to this episode of Digest This. If you enjoyed this episode, please leave a review in your podcast app to let us know. If you're ever wondering how you can support me and this podcast, sharing it with your friends and family is the best way. This is a Resonant Media production produced by Drake Peterson and edited by Mike Fry. To email the show, message us at digestthispod@gmail.com. See you next time. The content of this show is for educational and informational purposes only. It is not a substitute for individual medical and mental health advice and does not constitute a provider-patient relationship. As always, talk to your doctor or health team first.
Looking to build a more robust foundation in your health and well-being? From the producer of Digest This comes one of the most popular alternative health shows on Apple Podcasts, The Dr. Tina Show. Dr. Tina Moore is a naturopathic physician and chiropractor, traditionally and alternatively trained in science and medicine. The show features exclusive interviews with experts such as Sean Stevenson, Mike Mutzel, Mark Groves, and even solo episodes covering metabolic health, pharmaceuticals, chronic diseases, long hauler syndrome, and pain management. Dr. Tina delivers the information in a no-nonsense, real-world style, and she has the science to back it up. The Dr. Tina Show is edgy, entertaining, and informative. Every episode will leave you with a new pearl of health wisdom to expand your knowledge base. When you're empowered, you can do better for yourself, your family, and your community. Resilience is the name of the game, and Dr. Tina is here to guide you on your way. Listen to The Dr. Tina Show today on your favorite podcast app. New episodes every Wednesday. Produced by Drake Peterson and Resonant Media.